Your child deserves a beautiful smile. Early intervention by an orthodontist will correct or prevent problems during that. Dr. Joseph Renzi of Children's Hospital of Orange County describes the stages of treatment to correct problems.
Orthodontic evaluation is really an ongoing process. Beginning in approximately the first year of life, a child should have their first dental exam. At that time, not only is there going to be an assessment for other dental disease, such as dental cavities and other issues that might be occurring, but also an orthodontic evaluation should be performed by the pediatric dentist as well. That'll allow the parents to really have a good guide as far as what will be upcoming for them in the future. Some treatment might be initiated very early, some treatment might not be started until the child's approximately a teenager. So it really depends on what the problems are, but the evaluation should be ongoing and be assessed at a regular interval, usually at their regular checkups. The advantage of actually, when we say early intervention, looking at the child so that you can prevent problems from becoming bigger problems. There are some cases where we will actually start intervening and doing some early treatment as early as 3 to 4 years of age. On average, most children will usually benefit from phased treatment, which means there's a phase of treatment done in a school-aged child, usually around 7 or 8 years of age, with usually a resting period in between treatment phases. And final treatment is usually accomplished once all the permanent teeth erupt, which will normally be at approximately 12 years of age. So the advantage in early treatment is that if you have problems that are developing or that need some growth guidance, you have growth on your side since the child undergoes a tremendous amount of growth before 12 years of age. You can actually guide the individuals in terms of their development because you have the growth to help you. Orthodontic care is really to take care of two major issues, aesthetics and function. And the aesthetics issue is definitely a factor, especially in a young developing child, because pure intervention and pure interaction is definitely a factor. I have seen cases such as what you're describing where a child would not smile because of the position of the front teeth. If they did smile or they did talk, they would put their hand up in front of their mouth. And it was amazing to see how those children, once their teeth were straightened, actually had a change in their personality. They became much more extroverted, they talked more, they smiled more. Even with the braces on, even with the appliances in place, they were much different and much more available, so to speak, in terms of showing their teeth. So it definitely does have a big factor. I had one child that was, for lack of a better term, a very flared forefront teeth. The teeth were pronounced almost in a bunny-like type fashion. And this child would not smile, would not talk much, very introverted, and never really said that much about it. She really wasn't in a position to where she would actually identify that as the problem. It basically became a situation where I looked at her and said, we were going to do some treatment for her because I just know it's a problem for her. And it was amazing that after approximately, I'd say 3 to 6 months in treatment, the front teeth were pulled back, aesthetically she looked better, and her personality just opened up. She was much more talkative. It was like night and day. The introverted child that was shy in the corner was no longer the shy in the corner child. She was out speaking openly to anybody and everybody, even with the orthodontic appliances in place. So I've seen it actually affect a child in their world.